We welcome to the desk our good friend, Dr. Eugene Cherny, as we are here to talk about things involved with his practice, and of course, this is a special month.
This is a very special month because it's Breast Cancer Awareness Month. So I thought I would segue into other cancers that occur on the breast, which are very, very common, and people get them all the time. And the older they get, the more you get. In fact, we're starting to see them in young people too. And we're talking about skin cancer.
And you don't think about that. You think of breast cancer, you don't think of that otherwise.
Well, this kind of scares me. I don't know about you guys. As you get older, you find different colored spots on your body. But especially in kind of the breast area, there's a lot of different spots that show up. I don't know if that's sun or just the area itself, but I mean, they're kind of red, they're brown, they're all different kind of colors.
Exactly. This is an area, well, the face has the most skin cancer, but you can get it all over your body. But this area gets a lot of sun. It's called the décolletage, and it gets, just like the nose, gets a little more skin cancer because it's angled, it absorbs more sun energy. When you're standing, a lot of the sun energy bounces off the rest of your face, but because it's angled up, it just gets it all.
That little bit of angle makes that much of a difference.
Much more skin cancer on the nose than on the rest of the face.
I'll be darned.
And so the same thing on the décolletage. And when we're low-cut dresses, you know, we often are treating this just because it shows photo aging. So we do laser treatments and other things just to youthfulize it because the skin gets leathery and all these spots and stuff.
Well, it's one of those areas, unfortunately, we don't think about. If you're whether it's sunscreen or moisturizers or creams you're putting on, you kind of forget that spot.
This is the bad actor. I had a scare with one of these. My son sent me a picture of something on his shoulder, and it looked just like that.
Oh, no.
I flew him up to town just to take care of it myself so it could get done quickly, so we wouldn't have to like wait, you know, for a month to get into the dermatologist's office. And of all the things, this really has me psyched up about this because I did a big review of all the research on it, and it turns out that melanoma has tripled over the last few decades in its occurrence. And this is the bad actor. This is the one that can spread to other parts of your body and be fatal. And the dang thing that happened with my son was that his that looked so bad was benign, but he said, well, this one's been itching a little bit. And so I took off this one that I thought was very, very benign. Right. And dang if that wasn't precancerous.
No way.
And this is the one that just looked like a freckle or something. So this is why in my practice when I see moles that look benign, but the patient says they itch or they bother them in some way, I'm very liberal about biopsying them because one of the key signs of a skin cancer developing is that it has changed in some way. It's itched or it's bled or it's just changed in some way. And so I take off a lot of benign looking things, and it's not unusual that they're precancerous.
And there are different kinds of skin cancer?
There are. The most common ones are the ones that you know, older people get most often, but young people get them now too, and that's the basal cell cancer. That's the one that's on the sun-exposed areas. Classically, it was old farmers.
That'll be the one on the right on the picture.
Old farmers in the sun.
Yes, that's a very classic. It's just like kind of like a sore that just doesn't want to heal. So these are ones that they can spread, but it is so rare that I wouldn't really worry about it. Those just need to be removed. Those just need to be removed by your plastic surgeon or your dermatologist. Actually, dermatologists that do this technique called Mohs surgery, they do really well with it on the face, I have to say. And these are, I've seen these on the breast when I've been doing breast implants. So I'm taking them out, and lo and behold, but the excision is curative, and you don't have to worry about any testing or anything like that.
Okay.
The one that was next to it, which is squamous, that one gotten early, it's about the same as basal. It doesn't have a lot of risk, but that squamous cancer, if it's left to an advanced state, it can spread, and that can require, you know, oncology support and radiation and stuff like that too.
So the worry here is that is metastasize the right word and spread to other parts of the body?
Yes, that's when you got a real problem. Okay. And I've seen squamous on the breast also, a lot, especially up here on the higher décolletage. I've removed them at the same time putting breast implants just to make sure. And lo and behold, it's been something bad. But the big thing is the pigmented ones. Those are the ones that can be something.
Now, with this one here that I have on the surface, would that be something you need to be concerned with?
Well, I haven't got a ruler next to it. That one actually looks on the benign side. And
is that the one on my arm?
Yeah,
very close.
Oh, cool. Well, here's the criteria that you use. It's very simple. It's A, B, C, D, E. A is asymmetry. See, that one was nice and round.
Yeah.
B is the border. If the border is nice and crisp, you don't have to worry about it so much either then.
Oh, really?
The color, if the color is a light tan brown like that, that's usually benign.
Okay.
But so those are the three, A, B, C. Now, but the main thing is, again, if it's a certain size, it's big, or if it's present since birth, it's still worth removing, I would say. You still have a significant yield of cancers in that way. And again, evolution, if it's changing, have it looked at. That's the most important.
Now, what if your
thing.
skin has something like this that pops up on there?
That's something that that looks like it could be an evolving basal cell cancer. If a patient told me, oh, it's been there for years and it's no big deal, then I'd say we could watch it. But if it was something that popped up, like you said, I would strongly consider at least biopsying at least.
Now, if people have questions about spots that they're seeing, should they make an appointment with you, a dermatologist? How would that work?
I see these, but there's many excellent dermatologists in the city. We use the dermatology groups as colleagues. Sometimes when we find one on the face, we use this Mohs technique because that's the way of getting the skin cancer out without taking out a lot of extra skin. And we do the reconstructions. This is what we do a lot of the time. But I would highly recommend either seeing me or a dermatologist that you have a relationship with. Some people like my son who has normal things that have, that turn out to be bad on biopsy. These are people that need to be seen at least every year by the dermatologist to be checked out.
Now, if somebody doesn't have a dermatologist, because I don't think everybody has a dermatologist on call, can they get a hold of you and you point them in the right direction?
Piece of cake, that's right.
But it's an important thing to talk about, especially October being Breast Cancer Awareness Month. Don't, we always say check yourself, but that means skin too.
Skin too, and it's really good if you have a loved one who can look at you, like on your back.
I was going to say, because you can't see what's on your back.
That's right. And so there's all kinds of places like that. It's nice to have a loved one to check you out.
Okay. There you go. All right. Or just get a hold of Dr. Cherny and he'll be able to give you the information that you need.
Okie dokie.
Very good. Thank you so much, sir. Appreciate it.
Thank you, Doc.
so much.